The menstrual cycle is a monthly series of changes that occur in a woman's body to prepare for pregnancy. The cycle is controlled by hormones, primarily estrogen and progesterone, and is regulated by the hypothalamus and pituitary gland in the brain. The menstrual cycle can be divided into 4 stages: the menstrual phase, the follicular phase, the ovulatory phase, and the luteal phase. Menstrual phase: this is the phase when a woman experiences menstrual bleeding, which usually lasts for 3 to 7 days. During this time, the lining of the uterus sheds, and the menstrual blood is discharged from the body. Follicular phase: this phase begins on the first day of menstruation and lasts until ovulation. During this phase, the pituitary gland releases follicle-stimulating hormone, FSH, which causes several follicles in the ovaries to start developing. One of the follicles becomes dominant and continues to grow, while the others stop developing. Ovulatory phase: this phase occurs in the middle of the menstrual cycle, around day 14 in a 28-day cycle. The dominant follicle releases an egg, which travels down the fallopian tube towards the uterus. This is the time when a woman is most fertile and can become pregnant if she has sexual intercourse. Luteal phase: this phase begins after ovulation and lasts until the start of the next menstrual cycle. After ovulation, the follicle that released the egg becomes a structure called the corpus luteum, which produces progesterone. Progesterone prepares the lining of the uterus for implantation of a fertilized egg. If the egg is not fertilized, the corpus luteum breaks down, and the levels of estrogen and progesterone drop, leading to the start of the next menstrual cycle. The length of the menstrual cycle can vary, but the average cycle lasts around 28 days. However, cycles between 21 and 35 days are considered normal. Recently, which country declared menstrual leave for women? The Spanish Parliament approved paid leave for women suffering from incapacitating periods on February 16, making Spain the first country in Europe to do so. In Spain, women now have the option to take their monthly menstrual leave for 3 to 5 days if they feel uncomfortable during their periods. In March 2021, Indonesia's Supreme Court ruled that female employees were entitled to 2 days of menstrual leave each month. In addition, other countries such as Japan, South Korea, Taiwan, and some provinces in China also have laws or company policies that allow for menstrual leave, but the amount of leave and the eligibility criteria vary. It's worth noting that the concept of menstrual leave is somewhat controversial, with some arguing that it could reinforce gender stereotypes and discrimination against women in the workplace. Others argue that it is a necessary step towards gender equality and accommodating women's health needs. What are the physical and psychological changes took place during the menstrual cycle in women? During the menstrual cycle, women experience a variety of physical and psychological changes that are related to the hormonal fluctuations that occur throughout the cycle. Here are some of the changes that can occur. Physical changes. 1. Menstrual bleeding. This is the most obvious physical change that occurs during the menstrual cycle. 1. Women typically bleed for 3 to 7 days during the menstrual phase. 2. Cramps. Many women experience cramps during their period, which can range from mild to severe. 3. Bloating. Some women experience bloating and water retention during their period. 4. Breast tenderness. Some women may experience breast tenderness or swelling due to hormonal changes. 5. Changes in cervical mucus. Women may notice changes in the amount and consistency of their cervical mucus throughout the cycle. Psychological changes. 1. Mood swings. Many women experience mood swings during the menstrual cycle, which can be related to changes in hormone levels. 2. Irritability. Some women may feel more irritable or easily frustrated during the premenstrual phase. 3. Fatigue. Some women may feel more tired than usual during their period. 4. Anxiety. Women with premenstrual syndrome, PMS, may experience anxiety or feelings of nervousness during the premenstrual phase. 5. Depression. Some women may experience feelings of sadness or depression during the premenstrual phase or their period. It's worth noting that the severity and type of symptoms experienced during the menstrual cycle can vary widely between individuals. Some women may not experience any significant symptoms, while others may experience more severe symptoms that can affect their daily life. How to overcome the physical and psychological changes took place during the menstrual cycle by women. There are a variety of strategies that women can use to help manage the physical and psychological changes that occur during the menstrual cycle. Here are some tips. Exercise regularly. Regular exercise can help reduce symptoms like cramps, fatigue, and mood swings. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Eat a healthy diet. A healthy diet that is rich in fruits, vegetables, whole grains, and lean protein can help reduce inflammation and improve mood. Get enough sleep and rest. Getting enough sleep and rest is important for overall health and can help reduce fatigue and irritability. Manage stress. Stress can exacerbate symptoms like anxiety and mood swings. Try to incorporate stress-reducing practices like meditation, yoga, or deep breathing into your daily routine. Stay hydrated. Drinking enough water can help reduce bloating and water retention. Consider over-the-counter remedies. Over-the-counter pain relievers like ibuprofen can help reduce cramps and other physical symptoms. Supplements like magnesium and vitamin B6 may also help reduce symptoms like bloating and mood swings. Talk to your healthcare provider. If your symptoms are severe or significantly impacting your daily life, talk to your healthcare provider. They may be able to recommend other treatments or interventions to help manage your symptoms. This is part 1 of the video. Please subscribe and follow part 2 of the video in support of women and providing menstrual periods relief to every woman.